Chapter 3: Community and Home Care. Community health nursing focuses on preventing illness and improving the health of populations and communities. Community health nurses work in geographically and culturally diverse settings. They address the current and potential health needs of a population or a community. They promote and preserve the health of a population and are not limited to particular age groups or diagnoses. Public health nursing is a specialized area of community health nursing. Community and home care. Shifts in health priorities and delivery. More emphasis on prevention of disease and disability is starting to take place. There is an increased emphasis on brief hospital stays to reduce financial burden on individuals and insurance. Transfer of acute care to home-based nursing services. So instead of patients staying in the hospital for prolonged periods of times, they are being discharged home with home-based nursing care. Trends in maternal and infant health reveal progress in reducing infant and fetal deaths in certain areas. Also, a significant increase in the use of prenatal care. Gaps continue to remain in many other target areas. Low birth weight and very low birth weight births have increased. There are still significant disparities in infant mortality rates between Caucasians and other racial and ethnic groups. And the maternal mortality has not decreased since 1982, with a disproportionately high rates among African American and Hispanic women. The focus of health care today is preventative care. We're trying to target people before they acquire diseases. Primary prevention. The concept of primary prevention involves preventing the disease or condition before it occurs through health promotion activities, environmental protection, and specific protection against disease or injury. Its focus is on health promotion to reduce the person's vulnerability to any illness by strengthening the person's capacity to withstand physical, emotional, and environmental stressors. Secondary prevention. Secondary prevention is the early detection and treatment of adverse health conditions. This level of prevention is aimed at halting the disease, thus shortening its duration and severity to get the person back to a normal state of functioning. Health screenings are the mainstay of secondary prevention. Pregnancy testing, blood pressure evaluations, cholesterol monitoring, fecal occult blood testing, breast exams, mammography, hearing and vision exams, and pap smears are all examples of this level of prevention. Tertiary prevention is designed to reduce or limit the progression of a permanent, irreversible disease or disability. The purpose of tertiary prevention is to restore individuals to their maximum potential. Tertiary intervention takes place only if the condition results in a permanent disability. Tertiary prevention measures are supportive and restorative. For example, tertiary prevention efforts would focus on minimizing and managing the effects of a chronic illness such as CVA or chronic effects of sexually transmitted infections. Telephonic nursing care through services such as warm lines, nurse advice lines, and telephonic nursing assessments is a valuable means of managing healthcare problems and bridging the gaps among acute outpatient and home care services. Some providers are using the internet to communicate with patients who have an internet service provider. Nursing care that occurs by telephone is interactive and responsive to immediate healthcare questions about particular healthcare needs. Warm lines are telephone lines that are offered as a community service to provide new parents with support, encouragement, and basic parenting education. Nurse advice lines are toll-free nurse consultation services, often are supported by third-party payers or health maintenance organization, managed care organization, nurse case managers, and are designed to provide answers to medical questions. The Association of Women's Health, Obstetric and Neonatal Nurses, otherwise known as AWON, define home care as the provision of technical, psychologic, and other therapeutic support in the patient's home rather than in the institution. Telehealth and telemedicine makes it possible for patients to be interviewed and assessed by specialists located hundreds of miles away. Home care perinatal services may be provided by hospital-based programs, independent for-profit agencies, or nonprofit home care agencies, and official or tax-supported agencies. care. Thank you.